If your knees are stiff every morning or your hands ache before you've even had coffee, there's a good chance 5 specific foods on your plate are the real reason, not just your age. I'm a medical specialist, and after 60, most joint pain isn't simple wear and tear. It's inflammation, and you are feeding it, sometimes 3 times a day, without ever knowing it. By the end of this video, I'll show you all 5 of those foods, including the one almost nobody suspects, because it's something your own doctor has probably told you to eat more of. But first, tell me in the comments, how many days a week do your joints feel stiff before you're even out of bed? I read every one of these, and the answer might surprise you. Here's what surprises most of my patients when I tell them this in clinic. The stiffness in your knees every morning, the ache in your hands, the swelling in your fingers that makes it hard to open a jar. Much of that isn't your joints falling apart. It's your immune system responding to something you ate the night before. Last month, a patient of mine, a retired school teacher who loved gardening, came in convinced her knees were simply done. She'd already resigned herself to giving up her flower beds. 8 weeks after changing 3 things about her evening meals, she was back on her knees in the dirt planting bulbs for spring. Nothing about her joints had structurally changed. What changed was what was landing on her plate every night. I've spent more than 15 years treating joint disease, replacing hips, injecting knees, and watching patients cycle through the same 5 foods over and over without ever connecting the dots between their dinner plate and their pain. I've reviewed thousands of imaging scans where the cartilage damage flatly didn't match the level of pain a patient was reporting, which is exactly the mismatch that first pushed me to start asking about diet instead of just ordering another x-ray. Here's why you likely haven't heard any of this before. A standard appointment with an orthopedic specialist runs somewhere between 10 and 15 minutes. There's barely enough time to review imaging, discuss medication, and talk through injection or surgical options, let alone walk through what a patient ate for dinner the night before. Nutrition training in medical school is often minimal, sometimes just a handful of hours across an entire degree, so the conversation about food and inflammation falls through the cracks, appointment after appointment, for years. It isn't a conspiracy, it's a systems problem, and it's one you can work around starting tonight without waiting for the healthcare system to catch up. Your joints are lined with a thin tissue called the synovium, and it is packed with immune cells. In a healthy body, those cells sit quietly, doing routine maintenance, clearing out debris, keeping the joint lubricated and calm. But after 60, that system becomes far more reactive. Cartilage has less cushioning to begin with. The immune system, through a process called inflammaging, becomes chronically primed, quicker to overreact, slower to calm back down. And the margin between a joint that feels fine and a joint that flares becomes much, much smaller. Think of it this way. In your 30s and 40s, your body can absorb an inflammatory food here and there without much consequence. It has reserves, and it compensates automatically. After 60, many of those reserves are gone, and your joints are operating without a buffer. That's what makes food such a powerful lever after 60. Not because it's the only factor, genetics and joint mechanics matter too, but because it is the one factor almost entirely within your control, and almost nobody is told the truth about which foods are doing the damage. So let's start counting down. 5 foods. One of them you've probably already guessed. 2 of them will genuinely surprise you, and the last one might be the most important food swap you make all year because it's hiding inside something you were told was good for you. Let me ask you something. How often do you have toast, cereal, or a bagel for breakfast? What about white rice or pasta at dinner, more nights than not? I ask nearly every patient with joint pain this question, and the answer is almost always yes, more often than they realize. A slice of toast in the morning, a sandwich at lunch, pasta or white rice at dinner. None of it feels excessive, it feels completely normal. But from an inflammatory standpoint, refined carbohydrates are one of the most underestimated stressors on aging joints. Refined carbs are digested and absorbed rapidly, causing a sharp spike in blood sugar. Your body responds by releasing insulin, and that spike triggers the release of inflammatory messengers called cytokines, specifically ones like interleukin-6 and TNF-alpha, the same molecules directly implicated in cartilage breakdown and joint swelling. Combine that with a body that already runs a low-grade inflammatory baseline after 60, and every blood sugar spike becomes another log thrown onto a fire that never fully goes out. Your joints are trying to keep inflammation contained while simultaneously absorbing wave after wave of these new triggers. Studies have consistently linked diets high in refined carbohydrates and added sugar with increased markers of systemic inflammation, worse symptoms in osteoarthritis and rheumatoid arthritis, and faster progression of cartilage loss over time. The fix is uncomplicated. Swap white bread, white rice, and standard pasta for whole grain or legume-based alternatives. Even something as easy as choosing steel-cut oats over sugary cereal measurably lowers your inflammatory load over weeks, not years. Think of it in terms of how fast a food breaks down into sugar in your bloodstream, what's often called the glycemic index. White bread, white rice, and instant oatmeal sit near the top of that scale. Steel-cut oats, lentils, quinoa, and barley sit much lower, which means a slower, gentler rise in blood sugar and a correspondingly gentler inflammatory response. You don't need to memorize a glycemic index chart. An easy rule works almost as well. The less processed and more intact the grain looks, the slower it digests, and the easier it is on your joints. Does your typical day resemble what I just described? You might be surprised how many people answer yes without ever realizing it could be feeding their joint pain. That one alone explains a lot of morning stiffness, but it isn't even the biggest offender on this list. I need you to pay very close attention to this next one, because this is where some of the most preventable damage occurs. In my clinical experience, if you're over 60 and you enjoy bacon, sausage, deli meat, or fried food on a regular basis, and statistically, a large majority of people in this age group do, the type of fat you're consuming matters enormously, far more than most people are ever told. For most people, fat is fat, at least that's the assumption, but there's a critical distinction between omega-3 fats, which calm inflammation, and omega-6 and saturated fats, particularly from processed and fried sources, which actively promote it. Most modern diets are wildly imbalanced, sometimes 15 or 20 times more omega-6 than omega-3, when the ratio your body evolved to handle was closer to 1 to 1. I see the consequences of that imbalance on an operating table more often than most people would guess. This imbalance is known as the omega ratio problem. Most people have never heard of it, yet it is one of the strongest dietary predictors of joint inflammation we have. While your joints are trying to repair themselves overnight, arachidonic acid, a byproduct of excess omega-6 and saturated fat, is being converted into some of the most potent inflammatory compounds in the human body, prostaglandins and leukotrienes. These compounds don't just cause generalized inflammation, they specifically target joint tissue, worsening pain, stiffness, and swelling. If you eat processed or fried meat several times a week, your body may be manufacturing joint inflammation on a near daily basis, whether you feel it immediately or not. And if you rarely eat fatty fish, you may be missing the one food group capable of actively counteracting that process. So what should you do? Reduce processed and fried meats to occasional treats rather than daily staples. Add fatty fish, salmon, sardines, or mackerel 2 to 3 times a week. That single dietary shift takes minimal effort. There is strong scientific evidence, including multiple randomized trials, showing that increasing omega-3 intake significantly reduces joint stiffness and pain scores in patients with osteoarthritis and rheumatoid arthritis within as little as 12 weeks. That is not a minor adjustment. It is a conversation you should be having with your own diet today. This is part of why Mediterranean-style eating patterns show up so consistently in joint health research. It isn't one miracle ingredient, it's the overall ratio. More olive oil, more fatty fish, more vegetables, less processed and fried meat. Patients who shift toward that pattern, even partially, tend to report meaningful drops in morning stiffness within a couple of months, independent of any weight loss. Never assume all fat is created equal. In joint health, the type of fat can make all the difference. If you think that's bad, wait until you hear what your daily drink might be doing. Think about something you probably drink every single day, not water, not coffee, I mean soda, whether it's regular or diet, and fruit juice, the kind that says 100% natural right on the label. Most people don't think of drinks as a joint health issue. They think of sugar in terms of weight or diabetes, not their knees. I treat sugary beverages as one of the most direct joint aggravators I see in patients over 60, and I mean that literally. Fructose is metabolized almost entirely by your liver, and that process generates uric acid as a byproduct. Elevated uric acid is the direct cause of gout, one of the most painful inflammatory joint conditions that exists. Even below the threshold for a full gout attack, elevated uric acid contributes to generalized joint inflammation and swelling. It's a slow build most people never see coming. At the same time, sugary drinks spike blood glucose rapidly, triggering the same cytokine cascade we discussed with refined carbohydrates, except concentrated and absorbed even faster because there's no fiber or fat to slow it down. People who drink sugar-sweetened beverages regularly have measurably higher rates of osteoarthritis progression and significantly elevated risk of gout flares, and that risk climbs with every additional serving per day. Relief here comes easily. Replace sugary drinks with water, unsweetened tea, or sparkling water with a splash of citrus. If you drink fruit juice believing it's healthy, dilute it substantially or replace it with whole fruit, which contains fiber that slows sugar absorption dramatically. It's worth noting that gout itself becomes far more common after 60, particularly for anyone also managing high blood pressure or kidney function changes, both of which are common in this age group and both of which make uric acid harder for your body to clear. Layer a daily soda or juice habit on top of that, and you've created exactly the conditions gout needs to take hold, often in the big toe first, then spreading to ankles, knees, and fingers if it goes unaddressed. Do you have a sugary drink most days, even one you consider a small treat? Think carefully before you move from this one. Now here's where it gets a little different, because this next one isn't really about what you eat at all. It's about how you cook it. What do you use to cook your food, and how do you cook it? Most people have never considered that question from the perspective of joint health. They think about taste, about convenience, but how food is cooked can matter almost as much as what the food is. Grilling, frying, and broiling at high temperatures, especially with meat, generate compounds called advanced glycation end products, AGEs for short. Your body absorbs a portion of these compounds directly from food, and they accumulate in tissue over time, including cartilage, where they stiffen collagen and directly promote inflammation within the joint itself. A well-marbled steak charred on a grill isn't just calories and protein, it's a small dose of AGEs your joints will be processing for days. On the opposite end of the spectrum, cooking methods like steaming, poaching, stewing, and slow cooking at lower temperatures produce dramatically fewer AGEs, sometimes 50% fewer or more, even when using the exact same ingredients. For someone already living with osteoarthritis or rheumatoid arthritis, that difference in cooking method, repeated meal after meal, year after year, is far from insignificant. It is one of the quiet, cumulative factors that separates joints that stay relatively stable from joints that progressively worsen. The optimal approach isn't to eliminate grilling forever. It's balance. Favor moist, lower heat cooking methods for the majority of your meals. Marinating meat before grilling, particularly in acidic marinades like lemon juice or vinegar, has been shown to meaningfully reduce AGE formation as well. If you rely on an air fryer, you're already partway there, since it typically produces fewer AGEs than deep frying or open flame grilling, though still more than steaming or poaching. Oven roasting at moderate temperatures with a bit of liquid in the pan is another solid middle ground that keeps flavor without the same AGE load as high, dry heat. One small shift in how you cook, real protection for your joints. 4 down, 1 to go. And this last one is the food I get the most pushback on, because it's the one thing almost every patient assumes is helping them, not hurting them. Let's talk about a category of food driven by perfectly reasonable habits. And that's exactly why it's so easy to overlook. Many people over 60 eat dairy regularly because they were taught it's good for bone health. And in many ways, it is. Calcium matters. Vitamin D matters. I'm not telling you to eliminate dairy entirely, but there's a subset of patients, and it's larger than most people realize, for whom dairy is quietly triggering joint inflammation, and they have absolutely no idea. Some people carry a genetic sensitivity to a specific protein in dairy called A1 casein, which in sensitive individuals can trigger an inflammatory immune response very similar to a mild food intolerance. Others just consume enough dairy fat, cheese, cream, whole milk, that it compounds the saturated fat problem we already discussed. I've had patients cut their cheese habit in half and notice less morning stiffness within days, long before any weight change could explain it. Symptoms from a dairy sensitivity are rarely immediate. They show up 24 to 48 hours later as stiffness, swelling, or a flare that seems to come from nowhere, which is exactly why almost nobody connects it back to what they ate 2 nights before. I'm not asking you to eliminate dairy on blind faith. I'm asking you to run a straightforward 2-week experiment. Remove dairy entirely for 14 days, track your joint symptoms daily, then reintroduce it and watch what happens over the following 48 hours. For a meaningful percentage of my patients, that single experiment reveals a connection they never would have found otherwise. If dairy turns out not to be a trigger for you, wonderful, keep enjoying it, but you won't know until you actually look. It's worth being precise here because this often gets confused with lactose intolerance. Lactose intolerance is a digestive issue, gas, bloating, discomfort, caused by an inability to break down milk sugar. What we're discussing is different. An immune response to a specific dairy protein that can show up as joint inflammation with no digestive symptoms at all. You can have a completely normal digestive reaction to dairy and still be dealing with a joint-specific inflammatory response. That's exactly why so many people never suspect dairy in the first place. Have you ever gone more than a few days without dairy and noticed a difference, even a small one, in how your joints felt? Most people have never tested it. And if you've made it this far, that's 5 for 5. Every food most people assumed was neutral or even healthy, quietly working against their joints. Everything I've described so far may sound like a long list of foods to worry about, but I want you to look at it differently. When you put these 5 factors together, what you actually have is a practical blueprint for calming inflammation in your joints 1 meal at a time. I call it the anti-inflammatory plate. Build most meals around whole, minimally processed carbohydrates, vegetables, legumes, whole grains, rather than refined white flour and sugar. Include fatty fish 2 to 3 times per week and lean on olive oil rather than processed vegetable oils for daily cooking. Treat sugary drinks as a rare exception, not a daily habit. Favor gentler cooking methods, steaming, poaching, slow cooking for the majority of your meals during the week. And test your own sensitivity to dairy honestly, rather than assuming it either helps or harms you. None of this requires a dramatic overhaul of your life. It requires awareness of 5 specific choices you're likely already making without thinking about them. Here's what a single day might actually look like. Breakfast: steel-cut oats with berries and a handful of walnuts instead of cereal or white toast. Lunch: a salad with grilled or poached chicken, olive oil dressing, and a side of lentils or quinoa. Mid-afternoon: water or unsweetened tea instead of a soda break. Dinner: baked or poached salmon with roasted vegetables, cooked in olive oil rather than butter, finished well before 7 p.m. if your evening schedule allows it. None of that requires a special diet plan, a supplement, or a subscription. It requires making 5 small decisions differently than you made them yesterday. I'd like to speak to you honestly for a moment, not as a content creator, but as a clinician who has spent years in exam rooms with people in real pain. I have sat across from patients who could no longer open a jar of pickles, who had stopped gardening, who had given up walks with their grandchildren because their knees simply couldn't handle it anymore. That loss is never just physical. It's a quiet grief most patients never say out loud. Real change often arrived without anyone touching a patient's exercise routine or their medication. Patients reported less stiffness and less swelling within weeks simply by changing what was on their plate. Others discovered, through nothing more complicated than paying attention, that a food they'd eaten their entire life had been working against them the whole time, silently, meal after meal. These are not rare or exotic findings. They are the background pattern behind an enormous amount of ordinary everyday joint pain. Pain that gets written off as simply getting older, when in reality, a real part of it was sitting on a fork. Here's the greatest lesson years of clinical practice have taught me. Most of the joint pain I see doesn't exist because a body wore out. It exists because of missing information most patients were never given. Now you have that information. The question is what you'll do with it starting with your very next meal. Before we close, I want to address something patients ask me constantly. What about turmeric, fish oil capsules, or glucosamine? Supplements can play a supporting role for some people, and I'm not against them. But I've watched too many patients treat a turmeric capsule as a license to keep eating exactly the way they always have. A supplement is meant to support a good foundation, not replace one. If your dinner plate is working against your joints every night, no capsule is going to out-supplement that. Fix the plate first. Consider supplements second, and only with your doctor's input, since some can interact with blood thinners and other common medications. I bring this up because I've watched the reverse happen far more often than success stories. A cabinet full of joint supplements next to a fridge full of the exact foods driving the inflammation in the first place. That's not a failure of willpower. It's simply where the information gap tends to hide, and it's precisely the gap this video is meant to close. So let's bring it all together. 5 foods, 5 solutions. I want you to leave this video with a clear plan, not just a vague sense of concern. First, reduce refined carbohydrates, white bread, white rice, standard pasta, and replace them with whole grain or legume-based alternatives. Second, cut back on processed and fried meats and add fatty fish 2 to 3 times a week for its omega-3 content. Third, replace sugary sodas and juices with water, unsweetened tea, or sparkling water, especially if you've ever experienced gout or unexplained swelling. Fourth, favor gentler cooking methods, steaming, poaching, and slow cooking over high heat grilling and frying for the majority of your meals. Fifth, and this is the one most people never think to check, run an honest 2-week test on dairy to see whether it's quietly triggering your symptoms. I'd like to ask you something directly, and I genuinely want to know your answer in the comments below. Which of these 5 foods do you eat regularly without ever connecting it to your joint pain? I have a feeling at least 2 or 3 of them will sound familiar, and if they do, you're certainly not alone. Most of my patients recognize themselves somewhere on this list. The difference is that now you know what to look at. If you found this video helpful, please share it. There is almost certainly someone in your life, a parent, a spouse, a friend, dealing with joint pain who has never once connected it to what's on their plate. Send this video to them. Take care of your joints. They carry you through every single day of your life, quietly, without complaint, until they can't anymore. Give them the conditions they need to keep carrying you for years to come. One final thought. Everything I've shared with you today is general medical information based on current research in inflammation and joint health, along with my own clinical experience. It is not a substitute for personalized medical care. If you have a diagnosed condition like gout, rheumatoid arthritis, or another autoimmune joint disease, please talk with your own physician before making significant changes to your diet. That isn't just a disclaimer. It's sincere advice from someone who genuinely hopes your joints serve you well for decades to come. Take care of yourself, and starting with your next meal, take good care of your joints.